Good morning, everyone. I'm Tanzila from East West College of Engineering. I'm here today to talk to you about iontophoresis. Well, what's the first thing that comes to your mind when you see this picture? Okay, I'm here to give you the information you need to know about this process. I've divided my presentation into few sections. First, the introduction, then the components required, then the process of iontophoresis, followed by treatment duration precautions, and then the generator, and then advantages and complications, and finally the conclusion and the references. Now let's move on to our first section, that is the introduction. The term iontophoresis is simply defined as an ion transfer. The term ionto means ion and the phoresis means transfer. Thus, in short, it means the transfer of ions. It is a painless, sterile, and non-invasive technique for injecting medicine into the body with the help of electricity. So, non-invasive technique here means not involving any injections of instruments into the body. And iontophoresis is well classified for use in transdermal drug delivery. So I hope you're aware the two types of drug delivery. One is dermal, another one is transdermal. The dermal is transferring the medicine on the surface of the skin, like applying creams and moisturizers and stuffs like that. And transdermal mean transferring the drug within the layers of the skin to reach the bloodstream. Now let's move on to our next section, that is the components required. The power source for generating controlled direct current is the first component. Second, the electrodes contain and disperse the drug. Third, negatively or positively charged aqueous medication. Fourth, a localized treatment site. Now, moving on to the process of iontophoresis. I would like you to focus on this picture here. We can see that the device is placed on the skin with the help of two electrodes. The two electrodes are drug electrode, another one is a counter electrode. Now, the interaction of ions with that of the electric charge create a force which drives the ions into the skin. Now, this process of producing a solvent which carries the ions is called as the electroosmosis. Now, the flow of current helps to increase the permeability of the skin. Now, once the ions finally reach the skin, they combine with the existing ions in the body and reach the bloodstream. So, this is all about its working. I hope you're now clear about this. Now, moving on to the next section, that is the current intensity, which you must know. The recommended current intensity used for iontophoresis ranges between 3 to 5 milliamperes, and the frequency of current should be in the range of 500 Hz only to avoid shock hazards. The treatment duration. The treatment duration ranges between 10 to 20 minutes, 15 minutes being an average, and the patient should be comfortable with no reported or visible signs of pain or burning, and check the skin every 3 to 5 minutes looking for skin of irritation, and decrease the intensity during the treatment to accommodate the decrease in skin impedance to avoid pain or burning. So this means that if you find the skin impedance goes down a little, you must immediately decrease the intensity to avoid any burn or pain. Usage of pulse DC can reduce the duration of treatment, so thus it is more prescribed to use a pulse DC to shorten the treatment duration. Now, let's talk about few precautions you must be aware of. Use the most appropriate ions to accomplish the treatment goal, and use the appropriate treatment parameters and equipment setup. Don't use two chemicals under the same electrode even if they're of the same polarity, so use one chemical at a time. So you can see this picture here. Now, moving on to the generator. Let us see some facts about the generator. It assures a unidirectional flow of ions. It produces continuous direct current in the order as per the requirement, and the intensity control ranges from 1 to 5 milliamperes, and the constant voltage output that adjusts normal variations in tissue impedance, thus reducing the likelihood of burns. Automatic shutdown if skin impedance reduces to preset limit. Oh, that's a very good advantage here. And adjustable timer for giving the duration of the treatment. You can also control the time accordingly. Now, moving on to, this is a picture of a generator. This is how it looks like. And this is a very interesting picture of a generator which shows the functions, as you can all see. And you can notice two buttons there, the green and the purple one. The purple one is used to control the time duration, and the green one is used to control the current intensity. As you can see in the right picture on the display, it shows the time as well as the current. Now, come back to the left picture. You can see these two electrodes. I hope you're now aware of its working, as I explained you earlier. Now, let's talk about the advantages of iontophoresis. This is a painless technique if properly done, and it provides an option for patients unable to receive injections and reduced risk of infection to the non-invasive nature, so you need not worry about any sort of infections at all. And medications are delivered directly to the treatment site, so hence it is proved to be one of the best treatments across the globe, and minimizes the potential for tissue trauma from an injection, so you need not worry about the post-vaccination pain because there are no vaccinations used here. Now let us see a few complications, and let's come up with some solutions and how do we deal about this. The electric shocks may be caused if excessive current density occurs and usually results in pain. The shocks here don't mean the major shocks which paralyzes or occurs in death. The shocks here mean the short shocks, like the minor shocks which just result in pain. You can also avoid these by constantly monitoring the current density. And the second complication is the high current density and the time of application will generate extreme pH, resulting in a chemical burn. So sometimes if the treatment duration is a little longer, it might end up in burning the chemical. So you can make sure you can take breaks and also reduce the current density. And then iontophoresis cannot be done to patients with cardiac pacemakers. That's obvious. So, to round off the talk, I would like to conclude that the iontophoretic drug delivery has developed a new application system for dermal and transdermal delivery of drugs, and the iontophoretic delivery of macromolecules will open the doors to non-invasive transdermal delivery of peptide-based pharmaceuticals. Iontophoresis has been explored for many dermatologic and other medical conditions with reports of considerable success. Well, I think that's the end of my presentation. Let me now give you a brief summary of what I've been talking about over the last few minutes. I first spoke to you about the iontophoresis, what exactly is it about, and then I told you about the components required for the experiment, and then thirdly I told you how exactly it works with the help of a figure, and then I spoke to you about the duration and few precautions to be taken care of, and I also spoke to you about the generator, its functions, and showed you some pictures of how exactly it looks like. And finally, I spoke to you about the advantages and few complications, and I also gave you solutions on how to deal about those complications. And well, I think that's about it. I hope you now have a clear idea of iontophoresis, and if you have any questions or want additional information, I will be pleased to answer them. I hope you enjoyed this presentation. Thank you.